Welcome to the OVA vlog. Today we welcome Dr. Laura Nezworski, who is an OBGYN at HCMC, which is a hospital here in Minneapolis. Welcome.
Thank you.
Today we're talking about nutrition and exercise around both the time where you're thinking about getting pregnant and then the early pregnancy period. So we're going to start in this video specifically about diet, and then we're going to make the next one about exercise. So definitely watch that one as well. So if you are a woman who might be thinking about getting pregnant, what are some diet things to keep in mind that have to do with, improving fertility or that early fetal development?
Okay, so there was a great study that was done a couple of years ago through the Nurses Health Initiative that addressed this very thing related to ovulatory disorders of fertility. And they looked at a large number of women over an 8-year period of time, and did they get pregnant, and did they have certain characteristics about their diet and their lifestyle that improved their pregnancy chances. And the things that they found that were associated with less trouble with ovulation were having a regular exercise program. So doing exercise 30 minutes a day, every day, was correlated with improved fertility, as well as having a normal body mass index, a normal body weight. As well. Okay. And then there were some specific things that they looked at with food choices that seemed to improve ovulation, which were the type of fats that you consume. So monounsaturated fats seem to be better than trans fats. High-fat dairy products seem to be better than low-fat dairy products.
High-fat, not low-fat, yeah.
Yeah. Consumption of a multivitamin seemed to be helpful for folks, and things like coffee, alcohol did not seem to impair ovulatory fertility in any way.
Oh, that's really surprising. Wow. So you can drink your coffee and still get pregnant.
Yes, drink your coffee.
Awesome. So just to recap, 30 minutes a day of exercise, that's super doable. Like you can get that in, 30 minutes a day of exercise, keeping a body mass index within the healthy range, and then high-fat diet of good fats.
Right. So the monounsaturated are like avocados, olive oil, canola oil, and the trans fats would be like fried foods, baked goods,
processed baked
margarine.
Yep.
Yeah.
Awesome. Okay. So are there certain nutrients that you want to think about when you find out when you first find out you are pregnant? Are there a couple nutrients that we should kind of keep our eyes out for so that we make sure we're getting good fetal development?
Usually in the clinic, we recommend that folks start a prenatal vitamin before they become pregnant, usually a month ahead of time. And the reason for that is the folic acid that's in prenatal vitamins. So most prenatal vitamins have 400 to 800 micrograms of folic acid, which is actually really important in preventing birth defects of the brain and spinal cord, called neural tube defects like spina bifida or anencephaly. And the research is very clear that does prevent those things. Yes. And all prenatal vitamins really do address that nutrient. A couple of others that I draw attention to for folks would be iron. Would be important to have an iron in your prenatal vitamin, whatever it is, and omega-3 fatty acids are also really important for fetal development, fetal brain development, eye development. Seems to be supported by those things. There are some studies showing, in fact, improved cognitive scores and learning later on, and even they seem to be important in postnatal life or when the baby is born too. So those fatty acids do seem to be really important for development.
Can you get those from a prenatal vitamin?
Some prenatal vitamins do have DHA in them, and that's the specific fatty acid that was studied, which is just a concentrated form that you'd find in fish oil. So if your prenatal vitamin doesn't have DHA in it, you could just take a fish oil supplement or consume a couple servings of a low mercury fish per week.
Awesome. And so when you get a prenatal vitamin, you can just look on the back for, make sure it has iron, DHA, it should say all of those things. So and they all have folate, so awesome.
And then choline is the only other one to look for, and that one does seem to be transferred maternal to fetal during pregnancy at high rates and is important for neurologic development as well.
Okay, choline, awesome. Well, thank you so much for giving us some tips around diet, both for fertility and early pregnancy. Thank you.
You bet.
Thank you.
Thank you.